Well, Dr. Chiu, we talked about missing teeth and how missing teeth are a problem because once they're missing, other teeth start shifting, and the hinges, which you call the DMJ, stops working. Maybe you get even slight headache and muscle tensions. You even mentioned about cleaning becomes more difficult without people realizing it, and thus more cavities come, and thus again more tooth loss will happen. So we talked about that. Now, what are some of the main ways of fixing teeth? Have there been any advancements made in the last years or decades in dentistry? What options does a patient have there?
Well, the best option we have available right now is dental implants. And what it is a titanium cylinder we can place onto the jawbone, and that acts as like a root of a tooth. And we attach a crown to it, and that becomes one of the better ways to replace the missing tooth. It feels natural, it looks natural, and also acts as like tooth, and it preserves the bone around the jawbone, which is very important also. Different ways. Another
when you say preserves the bone around the jawbone, what you mean is that if a tooth is missing, you're losing the bone with it?
Yes. What happens is the jawbone doesn't have anything there to stimulate the bone to be there. Eventually, slowly would kind of melt away with time. The tooth will stimulate the jawbone to be there, or dental implant will also do the same thing.
So that's a big problem about having a missing tooth. So if you don't replace it, then your jawbones will shrink. And does that mean then you start looking like a dried out tomato? Is that, when your jawbone shrinks, the people have a flat face or a fallen in, caved in face? Is that the effect of that? Besides that, probably other teeth fall out more, which we talked about it before, missing tooth. But is that the case about ugly looking?
Yes, that's correct.
Wow. So, and if you if you don't put in an implant, which, that metal screw, I guess, is made out of titanium, right?
Titanium, or it could be porcelain. Yes, correct.
Okay, so that the titanium goes in there in the bone and acts like a real tooth, and by doing so, the jawbone doesn't shrink. Well, so that's wonderful. So that's one of the big advantages of an implant versus a bridge, I guess. So what about a bridge? If a person has a bridge, does he keep losing jawbones? And because a bridge has been for many, many years, with no doubt, a heavily used procedure, and still is heavily used. So tell us a little bit the advantage or disadvantage of a bridge versus an implant.
Well, bridge is still a very good restoration, but it has its advantage against the implant. The bridge, you have to sacrifice 2 teeth that are next to the tooth that is being replaced at. And it's true, it's not going to preserve the bone. So once the area where you have the tooth missing, the jawbone will still keep shrinking away. So that's the disadvantage that the bridge has over the implant. It's still a great restoration. It stays in your mouth, but it does not preserve the jawbone, and you gotta sacrifice 2 teeth to replace that tooth.
So basically, if you have a tooth missing and there's 2 teeth next to it, you need to grind them down in order to put this crown on it, and then hang a 3rd tooth, which makes it a bridge in it. So basically, you're destroying 2 good teeth when you wouldn't have to.
Yes, correct.
Is it true that sometimes when you grind the tooth down a little or a lot, it's a little bit like a tree? Sometimes you can cut the tree, you can, carve in, I love you, and the tree doesn't mind. Sometimes you carve in, I love you, and the tree minds very much and starts dying. Is that true with the tooth also, that if you grind down a tooth, the tooth could get some type of shock and then simply start slowly dying? And by doing so, you need to replace the whole bridge again, and probably with implant, and now you have more implants than before, or you need to again go further out and grind 2 more teeth down and keep going like that. Is that true?
Yes, that's very true. with the bridge, that's not a disadvantage. Is that once you sacrifice those healthy teeth, with time, cavity can come back on the area, and you have to replace that bridge every so often. Also, the fact that the teeth being grinded down, sometimes the nerve inside that tooth can get irritated and could potentially sometimes die, and which will need further treatment such as root canal to try to save the tooth. But yes, it's that's one of the disadvantages of the bridge. And with the dental implants, you don't have that disadvantage, and you don't have to worry about cavities causing any problem where you have to replace the crown again. How
often, Dr. Chiu, more or less, I know there's no real number, you cannot give us an exact year for sure, but more or less versus an implant, like does a crown, a bridge last 5, 10, 20 years, and an implant lasts 20, 30, 40 years? What are we talking about? More or less.
Well, more or less on an average, you could say that if you, on the bridge, you probably have to replace it maybe 2-3 times throughout your life, but maybe more depending on how often you see the dentist and how well you can keep it clean. Versus the implant, if you take good care of it, can potentially last you for the rest of your life.
Wow. So even though the implant might be a little bit more money at the beginning, and not necessarily a lot, because you're only fixing one tooth, otherwise you have to fix 3 teeth. But on the long run, for sure, an implant is also cheaper. Never mind, you don't have to go to the dentist and going through this ordeal again. Am I right? Am I reading that right or not?
Yes, that's correct, and that's why dental implants is one of the best ways to replace missing teeth naturally. Yes.
Right. Well, let me ask you one more question before I end off here. I've heard that when you have a crown, and again, not to knock the bridge, when you do not to knock the bridge, because obviously it has done a wonderful job for decades now, and it must be a lot better than George Washington, who had, I think, a wooden tooth in it. But the point is, so you have this bridge, as you said, with those 3 teeth or more, whatever, how many you need. Is it true that it becomes much more difficult to floss it because you cannot go in between, so you have to go underneath? Not impossible, but for a lazy guy like me, my wife and me enter the bathroom at the same time, we start brushing, or she's still brushing. I finish showering, shaving, and brushing, and she's still brushing on the first quadrum, I think. The point is, if I would have to go make it very complicated, even though doable, I would probably get on the lazy side, like with exercising, and next thing you know is I don't do it. Would that be a handicap for potential gum disease and failure of the bridge much faster again?
Yes, it is very true. With the bridge, it's a little more challenging keeping it clean. You do have to use something we call the floss threader, where you have to get the floss underneath the bridge and floss in between the bridge. It's a little more challenging, and if you don't do a good job at it, you can potentially get the cavity coming back on the area, or gum disease coming back on the area of the bridge and cause it to fail.
And you did mention in other videos on how extremely devastating a gum disease can be. Well, again, quite some information here, Dr. Chiu, and thank you very much.